Hello. Just a little bit of a heads up before we begin this episode of the NorthLakes podcast. This episode is about the end of the public health emergency and what has been called the unwinding of Medicaid, also known as Badger Care. A lot of the information in this episode is specific for the spring of 2023. So if you are listening to this later than that, this information may not be accurate. Call us at NorthLakes to get the most up-to-date information. We always look forward to speaking with you. Okay, now on to the show. Welcome to the NorthLakes podcast. I'm your host, Jeremy Oswald. This episode is a conversation with Patty Turner, who is one of our Access Program navigators, and it's about the ending of the public health emergency and what that means for people who are enrolled in Medicaid, also known as Badger Care, here in the state of Wisconsin. Patty does a great job of describing her role as an Access Program navigator, so I'll let her do that. Thanks for listening. Here we go. So, Patty, thanks for talking to me today. Tell us a little bit about who you are and what you do here at NorthLakes.
So I'm Patty Turner, and I work in the Turtle Lake Clinic as an Access Program Coordinator. And what our primary position is here is we're helping individuals through the insurance process. So if it's Badger Care or Medicaid, and we also help with the health insurance marketplace.
And if anybody knows anything about healthcare, it's a complicated field.
Oh, yes. Yes, it is.
So we, NorthLakes, kind of made this position to navigate that a little easier.
Yeah, absolutely. So I myself am down in Turtle Lake, and then we also have a navigator up in the Ashland area.
So what we want to talk about today is specific about, and you're going to know a lot more about this, but I'll just say it's what we're calling the unwinding of Medicaid.
Correct. Or Badger Care. So first of all, for those like me before I started working here, what is Medicaid? Medicaid is the state's program to help low-income families and individuals with health insurance.
So it's a state program to get people health care.
Correct.
All right, great. So what is the unwinding then? Why are we here talking today?
Yeah. So back in 2020, when COVID started, a law was passed that nobody could be taken off of Badger Care or Medicaid through the public health emergency. Now in December, it was signed to stop that continuous eligibility effective April 1st for all states. Some states are going to unwind a little bit faster than others. Wisconsin's going to take it nice and slow.
And so what does that mean? So what, like if I'm on, like for the last few years, let's just say I've been on Medicaid, I haven't needed to re-up or reapply or anything like that. It's just I've had it.
Yep. Nobody's had to renew or reapply since March of 2020. And everybody has gotten to stay on it, and they'll get to stay on it for sure until May 31st.
Then what happens?
If by chance you're over income for Badger Care or Medicaid, you will get a notice in the mail starting in March stating that you're no longer eligible and you will be terminated from Badger Care or Medicaid.
So then what happens if you don't have Medicaid anymore?
So you can either reapply if your income has changed since last reported, or you can apply for the health insurance marketplace.
And you help people with that?
I do.
All right. So what is good about Medicaid? Why would someone want to be on it, or how is it helpful? Or tell us just a little bit more why it might be good to stay on Medicaid if you're eligible.
Yeah. So with Badger Care and Medicaid, it's going to cover all your medical events. So if it's a trip to the doctor for an ear infection or a pregnancy or an emergency room visit, it's going to be covered. Other things that are covered is transportation to those events. So if you, even to the pharmacy, All that is covered for Badger Care and Medicaid patients.
So if you have it, that's like a component of your health care you don't need to worry about. You're like, I'm covered. I don't need to worry about how I'm going to pay for this.
Pretty much. I mean, some things do get denied, but there's also people out there to help get you through those.
All right. So I was on the marketplace for a little bit. How's that different? I mean, is it the similar kind of coverage, or it's been a little while since I was on it.
Yeah.
Has it changed, or what's going on with that?
So the only thing that has really changed is because of the public health emergency, they have elected to give individuals a higher
deductible.
No. The premiums are lower due to the advanced tax credits. And then also they're getting more of a cost reduction in their deductibles and out-of-pocket maximums if they're under a certain percent federal poverty level. And also, if you're under 150% federal poverty level, you can get onto the marketplace at any time throughout the year, which is a big change.
And before it was that there was a kind of a moment like at the end of the year where that it would be open for any to apply.
Yep.
To enroll.
Yeah. So prior to this, you could only enroll during open enrollment or a special enrollment period. So say you lost your coverage, you moved, things like that. But now, as long as you're under the 150% federal poverty level, you can apply anytime during the year. It would start the next month. Now, if you're over that, your open enrollment rules still apply.
Okay, got it. So there has been a slight change. So if you had been part of Badger Care or Medicaid,
yep,
that we'll unwind it. You no longer qualify, but you're able now to get onto the marketplace. Yep.
And NorthLakes has 3 certified application counselors to help you through that. 1 in Turtle Lake, 1 in Ashland, and 1 in Hayward.
What are some of the things you help people with? Like, what are some common barriers that people have and that you're able to help them with?
Yeah. So one is just technology, honestly. The health insurance website and the access website for Badger Care can be very complicated. We do it quite often, so we're used to the websites, but when they change something, it's always a learning curve, even for us.
So I'm thinking of, I'm going to pick on my mom. I always kind of do. Sorry, Mom. But, she's not in front of a computer all the time.
Right.
So I could see can you help her? No, she lives in Michigan. So, but is that a common thing where people just aren't familiar with how to do it? Yeah.
A lot of people don't have the internet, especially in our rural areas. A lot of them don't have a computer that's working properly or fast enough. A lot of people forget their username and passwords, and luckily, a law has changed to allow a certified application counselor to keep their username and password under lock and key. So that way, if they forget it, then we can still help them through the process.
Oh, that's got to be super helpful.
That's super helpful, especially for us.
And you just said, here's something I didn't even think about. You just said a certified application counselor.
Yeah. So for the marketplace, you have to be certified. We are licensed through the state of Wisconsin for insurance, and we have to do 16 hours of in-person training and at least 16 hours of online training every year.
And is that helpful?
It's beyond helpful, especially the in-person training, because we can network with other providers and other certified application counselors in all parts of the state who are experiencing different problems, and we can work through them together. So that way we all have knowledge of that problem.
Oh, so as this program's gotten a little bit older, they're starting to work a little of the kinks out?
Oh, yeah.
Okay.
Yeah.
So it's better than it was.
Oh, yes. The networking has been amazing. We meet at least once a month through either Zoom meetings or different kinds of virtual meetings, and it has gained a lot of knowledge in that area.
Oh, good. So again, let's maybe not get back to my mom, but that somebody there, is there usually an event that makes people kind of think about insurance, or what kind of like, how do they end up in your office or on your phone?
Yeah. Most individuals, when they end up here, they have either came into a clinic and they don't have health insurance, which they can apply for the NorthLakes sliding fee scale, but that means that they can come here and we'll help them here, but not necessarily in other facilities. So like if they ended up in the emergency room, they wouldn't have coverage there. So that's where a lot of people come to me or one of the other navigators or certified application counselors, or even our CHWs can help with Badger Care.
Community health workers.
Yeah.
For those who aren't.
Oh, what are the community health workers?
Well, I use that and I'm just throwing, I don't know if everybody knows what a CHW.
Oh, I'm sorry.
That's okay. That's all right. We love our acronyms.
We do. Yes. Sorry.
Oh, that's okay. And maybe what's a community health worker?
Yeah. So the community health workers help with the social determinants of health. So anything that is a barrier to your health. So if that means it's housing, transportation, insurance, childcare, budgeting, there's so many things that the community health workers have been trained to help with.
Yes. So just and I did, if you are curious, you can go into our other podcast. I did talk to Brenda and Chris. So there's a good podcast all about them. So
there you go.
They already had their moment in the sun.
Yeah.
So, I'm going to guess, I use that phrase too much on this podcast, I think, but I'm going to guess that ideally somebody who is qualified or could get on Medicaid, in your mind, Badger Care.
Yeah.
They should do it like now before they come here or before there's an emergency, just so they have it. Is that true? I mean,
they don't have to do it prior to coming in. Nope. Badger Care and Medicaid will backdate up to 3 months.
Oh,
if they're eligible.
Mm-hmm. But it's nice because you can use it for non-emergency things. There's probably people that don't realize they may qualify for it.
Correct.
But it's good for primary care, like lots of things.
Yep. Right? Primary care, behavioral health, chiropractic, dental, vision, transportation, to any covered service for Medicaid prescriptions. I think it's just about any service here. Any medical need. Yeah.
So it's we're big fans.
Yes.
And I don't want to get too far into it, but I know that NorthLakes, because we're a federally qualified health center, that means we have a different kind of relationship with Medicaid, or what's that like?
So that means that all of our clinics have to accept the Medicaid services, the Medicaid insurance for their services.
Got it. So with the unwinding, are people aware that it's going to happen, or like if you're on it, like probably the last 2 or 3 years, it's probably not something you've really.
It's probably out of sight, out of mind. So prior to the public health emergency, people were getting renewals every year, and they haven't seen them for 3 years now. They will receive a letter in March stating if their coverage will end in May or if they're going to start renewals. And on that letter, it will give their renewal date. Another thing Wisconsin is doing this year is they will start texting individuals as long as they have permission on their charts to to give them their heads up notices.
So what should somebody do if they see a piece of mail from who does it come from? Like, is it Medicaid in the, like, how will they know it? What should they look for?
Yeah. So it'll come from the state of Wisconsin. So it says state of Wisconsin on the top right of the corner, or top right corner of the page.
Left. That's right on this. I'm envisioning a letter too. Is over where the stamp is.
Yep.
Stamp
well, not on the envelope. It's on the actual letter.
On the return address.
No, actually, when you open the mail, it's on the letter.
Oh, I was. What does the envelope look like? Have you seen?
I have seen them, but I'm trying to think. I think they're pretty generic envelopes.
So if someone's on Medicaid, advice would be to like make sure you're opening anything from the state of Wisconsin.
Yeah.
Okay.
Yep.
All right. And then, sorry, I was thinking envelope. You were thinking letter.
Yep.
What's on the upper right? I'm sorry.
It just states the state of Wisconsin and also their case number on the upper right corner of the letter.
I threw you. I'm sorry.
That's all right.
And so what should someone do when they get that letter?
So there will be instructions on there. They can call their local consortium, which the phone number will be on the letter. They can go on to the access.wisconsin.gov website and update information that way. They can go on to the Wisconsin Access app, phone app, update information that way, upload documents if needed on there, or they can contact Navigator or CHW here at NorthLakes. And we're more than happy to help with that process.
And just because you get this letter doesn't mean you're going to be removed from Medicaid. You very well may still qualify for it.
When they receive the letter and they see their renewal date, it's going to be anywhere from June of 2023 to May of 2024. So it's going to be a long drawn out process. So they just really need to pay attention when their actual renewal is.
Are there people that will lose their Medicaid coverage, and what would have changed for them?
Yeah. So anybody who has reported that they've been working since COVID started, they still have their Badger Care because nobody was allowed to be taken off unless they moved out of state. So those individuals are going to be the ones to receive the letter that their Badger Care or Medicaid are going to be terminating effective May 31st. If by chance, since they've reported that something else has changed, they can always reapply for Badger Care Medicaid. Got
it. Do you have are there a lot of people that are going to lose coverage? Have you heard anything about anything like that?
I haven't. I think the last number I heard is there's 20,000 people that have had that continuous coverage.
And do you have kind of a list of people that you help, of our patients that you kind of keep track of, that you contact them as well? Or
so Northlake has the ability to run a report, and we will be sending out a text message at the beginning of March, I think next week, just saying, hey, watch your mail. But we will send out another one later in the process saying, hey, if you want help with this, please click yes. And then we're going to text them or call them and set up appointments to help them.
And if anyone is listening to this, this is a two-parter, I guess. Do they need to necessarily be a NorthLakes patient to reach out to you?
No.
Okay. And then, if, as you've been saying, if they have any questions at all, just reach out.
Correct. Yeah. So part of our requirements as certified application counselors for the state of Wisconsin is we cannot discriminate against patients or not. So we have to help the entire community.
Well, that's nice.
Yes.
That seems like right up your alley, Patty.
It is.
Okay, good. So what other kind of, are there, I hate to call them maybe hardships, but if you're on Badger Care Medicaid, are you getting a lot of mail that you might be easy to miss this letter? Or what's the paper trail like if you're receive Medicaid or Badger Care?
Yeah. So normally you probably receive documentations about every 3 months prior to the public health emergencies. Now you're maybe getting something once a year. So just pay attention that it is going to be in March. You're going to start receiving documents.
Okay. So I guess I'm thinking of like sometimes I get like on a mailing list or something where I'm just getting mail like all the time. And I'm like,
Yeah, no, I don't think it's going to be that way. I think you're going to get your letter in March, and then you're going to get a letter 60 days prior to your renewal, and you'll get a text message 45 days prior to your renewal. But other than that, they won't. And then they'll send you your termination letter as well. But you're not going to continuously get letters.
Got it. Okay. I'm just thinking of some groups that they'll send me 10 pieces of mail. 9 of them are for something other that like maybe it's easy to ignore. And the 10th piece, it's not like that.
No, you should definitely look at all your Badger Care and Medicaid documents.
Okay. All right. And not everybody is going to need to come to you for help. There's like, it's like if someone feels comfortable doing it on their own, they should just do it. And like, but if maybe they have one question, like line 7, I wasn't sure about. That's one thing you could help them with. Just help them on the phone.
Right. Yeah. We can do all of our appointments via phone, or in person. So that is helpful. Especially for like our Lakewood patients, we don't have someone over there to help with insurance. So they do call me. So that's been a fun adventure. But so they can call any of the local clinics, their local NorthLakes clinic, and they can be put onto a community health worker schedule or a navigator schedule, and they can be reached via phone.
Okay. And what are some common problems that people have when they're trying to either apply for or renew their Medicaid and Badger Care?
The number one problem is honestly setting up the account, finding the correct case numbers or the ID numbers, setting up the passwords and things like that. That is honestly the hardest part of the application. But a lot of income is the income reporting is another big problem that people struggle with.
I couldn't tell you how to find it in I know it's somewhere.
Right. Yeah.
I hear that a lot.
Yeah.
And, so how are you able to help someone? You said earlier that you're able to, like, if someone loses a password, you might have it, or you know how to help them with it.
Yeah. We know how to, reset up the accounts, also, so then it can link it to their old one without waiting on hold for hours and hours, which especially right now you're going to end up doing. But also we can then keep the password here at NorthLakes, and then it's under lock and key. So that way no one has access to it besides the certified application counselors, navigators, or CHWs.
So you're a little bit of an IT person.
A little bit. Very little bit.
Right. And you said if someone does lose, they no longer qualify for Medicaid, they can get on the marketplace.
Yep.
And you did mention the sliding fee scale.
Yeah.
Tell me a little bit more about that.
So the sliding fee scale is a program through NorthLakes, and they would just need to come in and apply, or they can request an application over the phone, and you just need to turn in your income, same as you would with Badger Care, Medicaid.
And so if you qualify for the sliding fee scale, what does that mean? How does that help you out?
So NorthLakes would help you pay your bill, and everybody would qualify for a different amount. So it would be based on their income.
Oh, and that's something unique to Federal Qualified Health Center.
Yeah.
As NorthLakes.
Yep.
Got it. So we've kind of been talking specifically about healthcare. And I don't know if this is like how the unwinding is going to affect healthcare. Do you have any insight on how it's going to affect people in other ways?
Yeah. So the food share program is also unwinding. That has already started. So people should have started receiving their renewals already. They also have stopped giving out the extra food share income that they were giving out throughout the pandemic.
And what is that?
So they were making sure everybody had the max amount of food share for their family. So say a lot of families, if they're a little bit higher income, low income, but higher in that area, they would normally receive, say, $20 a month, but they were receiving the max amount for that family size.
Got it. Are there some online resources that people can go to that could help them out?
Yeah, absolutely. So if they are just renewing their Badger Care, they can either use the access.wisconsin.gov website, or they can log into the mobile app at Access Wisconsin. It's a blue app with the state of Wisconsin on it. So if that's what they're looking for. Both places you can update information, apply, and upload your documents.
Okay, and I can include those on the show notes.
Yeah.
So I'll put those links in there. But,
okay.
But if someone doesn't want to go that, what would the Google search be? Access Wisconsin?
Access Wisconsin.
Okay. Great.
And then also they can, if by chance they lose their Badger Care, they can go to healthcare.gov, G-O-V. Do not click on any other healthcare dot anything.
There's some imposters out there?
There is a lot of imposters, and they will get inundated with phone calls.
Oh, no. Okay. So what if, oh man, I didn't even think of that. So what's some advice to give people as they're clicking away?
Yeah. Make sure it's healthcare.gov.
Because there's people that have built a lot of.
Yeah.
Oh, and that's another maybe good reason. So if they have they're like, I'm not sure if I'm on the right website.
Right. They can always contact a certified application counselor.
Oh my gosh. I get we got, I don't know, like we all here at NorthLakes got a kind of a common email, like hey, thank you thing. And I think all of us went like, what is this?
Yeah.
Were you like, yeah, because I don't know. I'm very suspicious these days.
I am too.
for good reason.
Yep.
We could do a whole nother episode. Like we could take our IT knowledge here and like try to apply it to this, Pat.
Yeah.
I think like we could go on the IT train and like be that for those. No.
I'm not a good IT person, but
we have good radar for it.
Yes.
Okay.
People really, really need to make sure that they check their mail, open their mail, and call for help. If they have any questions, make sure they call for help.
And if you are on Badger Care and Medicaid, I'd say, could we say take advantage of that and go see your primary care physician? And
yeah, absolutely. Definitely get in those final visits before May 31st. And because once you're on the marketplace, you will have deductibles and out-of-pockets. That is the difference between the marketplace and Medicaid and Badger Care.
So take advantage of it. And if you're not losing it, like, they're there for a reason.
Yep.
And come here to NorthLakes. We want to help you. Yes.
Especially for dental and vision. Mm-hmm. Those things are not covered on the health insurance marketplace.
Oh, good to know. All right.
Yeah.
I have one last question for you, Patty.
Yeah.
What's in your car right now?
What's in my car?
Uh-huh.
I have kids, so I have car seats and blankets, jumper cables, a softball glove. That's about it, because I cleaned my car out. But
is it season right now? Or I kind of drove through a snowstorm to get here. And you're playing softball already? Actually,
the varsity just started yesterday. Just open gym, so not coachable yet, but the girls are playing together. But our middle daughter, she's practicing pitching. So we go to pitching clinics. And so we just keep the softball gloves in the car.
Oh, excellent. Patty Turner, thank you so much for doing this. And thanks for being on the NorthLakes podcast. It's great to talk to you.
Thank you.
Okay. Bye.
Bye-bye.
We talked about a lot there, but here are the basics that Patty wanted me to share. Continuous eligibility for Badger Care and Medicaid is ending on April 1st, 2023. People will receive a letter in March. The termination date for some individuals will be March 31st, 2023. Everyone else renewal will start in June of 2023 and end in May of 2024. Thank you for all the information, Patty. It was great to talk to you. NorthLakes Community Clinic is a federally qualified health center with locations throughout the northern part of Wisconsin. Learn more about what we do by visiting our website, nlccwi.org. You can find our locations, the services we offer, videos of our providers, and much more. I'm Jeremy Oswald, and I'm a marketing and communications specialist here at NorthLakes. Please share and comment on the NorthLakes podcast. We'd love to know what you think. And thanks for listening.